Alrighty, we just hit 11:01. So we are going to go ahead and get started. Thank you guys so much for being here. I'm Stephanie here with Every Dog, a nonprofit in Austin, Texas, dedicated to making sure that everybody has the access to behavior resources that they need for their pup. Thank you all too who donated when they signed up for this webinar. If you would like to donate, you can do that at everydogaustin.org/donate. Again, a few reminders, keep yourself muted throughout the presentation. If you have any questions, feel free to pop them in the chat box. This webinar is being recorded, so we will send it out to everybody after the webinar. It may take a couple days, but we'll make sure to get that link to you. And I would like to go ahead and kick it off to our speaker to allow her to introduce herself. Thank you so much for being here, and I'll see you guys soon.
Great. First question, is my right screen sharing?
Yes.
Okay, it is. So you can only see the big one.
Yep.
Okay, great. Okay. So, first of all, thank you so much, to be here. I'm very, very excited. So today we're going to talk about mastering cooperative care from stress to trust with start buttons. My name is Tamiara Optenkelder. I'm a certified dog trainer and behavior consultant, and my company is called Zorg Zonder Dwang. As you might see, it's not an English company. It's a Dutch company. I'm Dutch based, and I'm specialized in cooperative care. And if I would refer to Zorg Zonder Dwang, I would call it ZZD because I know it's very hard to pronounce as an English speaker. So, I am a certified dog trainer and behavior consultant. I'm also a student in psychology right now. After I graduated as behavior consultant, I was like, I want to learn and know a way, way, way more. I regularly give workshops and lectures, mostly in Dutch, but I'm trying to pick it up now on English. I'm also a teacher on a school for dog trainers, and I also have designed a tooth tool, which I'm gonna show later in this presentation because yeah, that's a very big part into making cooperative care more reachable for more people. So before we get started, I always think it's very important to make sure that you feel free to ask anything. I'm always interested in like what you think about it, why is something like that, and if you have any questions, put them in the chat. Because it will make it a lot more also engaging at the end. And like, I want you to really see the information, get the questions about it, because I don't want you to just like, okay, that's the information and I just apply it. No, get to really know the stuff so that you really feel like you get it. That's the most important thing for me. So if you have any questions, just pop them in the chat. A little bit about my story. I started a few years ago. I'm now already giving 4 or 5 years specialized training in cooperative care. And it all started because of this lovely girl. Her name is Difra. She's an Icelandic sheepdog of 8 years old. Currently she's laying beside me. She is still quiet, so we're hoping that it stays that way. And it all started with her because she has D-claws on her back paws. She has like double ones, and those ones cannot, yeah, they will grow longer and longer until you cut them, or she like bites them off, but she didn't. So what happened is that from puppy of on, I wanted to make sure that it was okay for her, like her nails were good, but it was such a stressful thing that I decided to go to the groomer, and the groomer could do it, but she was really on the edge of biting the groomer. And at that point, I was like, okay, we need to make sure that this changes because this can't go on any longer. And that's when I started to dive into cooperative care because of her. And it's so, so important because she is an example of like physical health can be harmed, also the safety of the groomer, but also for me, but especially for the groomer at that time. And also, third is also the mental health. Like she had stress, she had to go every 4 weeks to the groomer. A lot of stress also for me, and also like our connection was harmed by it. And I always start with this story a bit because for me it's important, if you are gonna do cooperative care, know your why, because it's gonna be sometimes difficult. It's also gonna be hard to keep motivated because there are so many small steps that you need. So sometimes it's hard to stay motivated, but that's why it's so important to remember your name, your why. So, my mission is giving dog owners and dog professionals the theoretical knowledge and practical tools to provide cooperative care. So, tonight we're also going to do that. We're going to focus on the theory and we're also going to focus on making it practical. And we're going to talk about the 5 steps to build up any care procedure. We're going to talk about what to do when care is needed, what choice and control is in care training, how to use the start, stop, and continue buttons, and also the 3 most important foundation behaviors. Um, very, very important is the first step. I have used this scheme for like a few years now, and if you apply this scheme to any care procedure, you will get through it. And what I mean by it, we're also gonna look it through. Is management, is the foundation, is start and stop buttons, and desensitization and counter conditioning. And most people start actually in the start stop buttons or mostly the counter conditioning. Like, okay, you get a paw from your dog, you're gonna treat him for giving the paw, you're gonna maybe like brush it, and you're gonna give a treat. And that's usually how we start, even though there are actually steps in front of it. Especially the management is a very important part, but also the foundation in training is usually often needed to succeed in cooperative care. And after that, then you're gonna expand to the veterinarian, to the groomer. You can also start there, but I found it really more easy for the dog to start in a safe place at home than at the veterinarian, where there are already like so many smells, people, scared things that have happened in the past. So for me, it's always important to follow these steps, and I'm gonna take you through it tonight. So I'm first curious, and you can pop it into the chat if you want to, but also write it down for yourself. Which care procedures does your dog struggle with? Because after tonight, or like after this small 1 hour, I hope you have a sort of plan for yourself that you're like, okay, I'm gonna focus on those care procedures, and I have like a sort of feeling, okay, how can I build that up? So I'm very curious, yeah, like which care procedures does your dog has trouble with? And if you have written those down, I want you to ask also to pick 2 of them maximum, because I know there are a lot of procedures that people want to do with the dog. I also want to do that. I want to do everything with her in cooperation if possible, but we only have 24 hours in a day, so we have to make yeah, exactly here also a reaction. Oh yeah, I know. So we have to make a decision. Okay, which one am I gonna choose? So I want to give a little few tips for that. Firstly, how important is it for your dog's health? For example, my own dogs, her back claws, if I didn't groom them, they could have grown into her skin, which is not very nice. But for example, her harness, she's not the biggest fan of, but she finds it okay. Even though that's like every day, I would still then choose the nail trimming over the harness. But also make sure that if you choose a procedure, how important is it for you? And how aversive is it for your dog? If your dog hates maybe like going into the bath or like hates bathing, then and you have like a toy put or something, you need to do it like on a regular base. Okay, then that can be like your first goal to achieve instead of nail clipping. If, and then we're gonna go to the second slide, if we're gonna do something else about it in management. But thank you also so much for sharing in the chats which ones you all want to do, especially nail clipping I read. Um, so we're gonna go and continue. Let's see if it wants to do. Ah, yes, it was there. And we're going to focus on the first step on management. So, other solutions, because we can train a lot. We can definitely train a lot. But to make it easy for yourself and to also make it doable, I always first look at other solutions. For example, if you have a dog who is afraid of his harness or who doesn't like his harness, first make sure, do you have a right fitted harness? Doesn't it like irritate on the shoulders? And if the dog is scared to like put it over his head, maybe you can use a harness with like 4 clips as shown in the picture. Maybe you can use that. And by doing that, you can skip the whole training process because it was just uncomfortable for your dog in a certain reason. And you don't have to train that behavior. The other part is, for example, nail scratch boards. I know they are getting more famous and famous, and I'm very happy for it. I always do say it's a temporary solution because it can be like the nails cannot be even when they are gone. So that's why I don't really recommend it. But it can help in the time that you're practicing to nail clipping. Also, for example, the tooth tool. I was already talking about it. The tooth tool is like a small device that your dog can just grab himself, and then after that you can brush his teeth. So what it does, especially the molars and like the inside of the teeth, you can brush with this tool instead of like forcing the mouth open, and your dog has more control using this. So those are like other solutions to look at that may prevent or like may decrease your training for a certain bit or take off the pressure. Also, having the right materials is a quick thing to change and being able to like speed up your process or to not have to train. For example, if your dog is scared of a nail clipper and he is maybe okay with like a vacuum cleaner or a blow dryer, maybe he is also okay then with like a grinder or a Dremel. I don't know if you say that also in English, like Dremel, but we call it a Dremel. So maybe that one you could use instead of a nail clipper. And a very simple example, my mom also has a dog, and her dog had like a thumbnail with like a little tiny sharp nail on it. And she just had to file it, and then it was okay. And she was like already stressed on like maybe getting a nail clipper, and it was only a file that was needed. And so simple can it be. But also having the right materials, of course. So, for example, if you have the grinder, make sure that you have the right blades. Also, ask your groomer nearby. Is this the right tool? They are the ones with expertise on that. I also have a scheme. If you want to, you can always send me a message, and I will share it happily for you. But also make sure that you have the right brush and the right comb. Sometimes that change can already make it 10 times more easy for your dog. And a third thing to look is pain, especially with cooperative care and especially with care procedures. Pain is usually the one that is playing a very big role when your dog doesn't like to be handled. Pain causes also a higher stress system. It causes that again also can cause like mentally issues, and that can also go again also like go back into like more physical issues, and it's like a circle that you're like continuing in. But also very practical if your dog has hurt his shoulder or if he has like issues in his hip and you want to groom him there and he says no by growling or by walking away, then it's the first step to examine, okay, what is going on there? Because if we just keep continuing and trying to train that behavior to like stay calm, like lay down and like build up the steps, and we're keep getting a no, it might not be the case of, okay, those steps are not working. It might be just the case, okay, he has pain and he just doesn't want to be touched. Also note, this will be recorded, of course, so you can always watch it back. But these are some questions that I always ask my clients. Okay, how does the nails look like? How does he chew? How does he stand up? Put it on video, put it on a little note for yourself, and like really observe your dog if he might have pain. A example for this is that 6 out of 10 dogs that I have or had in guidance had gut problems when they were having an issue with their harness. 6 out of 10 dogs. And that I just want to show you with that we first always think, okay, maybe it's like behavior and maybe he just doesn't want it. But it's so important to see that it's not always the case and that sometimes pain is the reason that your dog says no. So please, if you have any doubt, just make sure to book in a session with your veterinarian or with your dog's physiotherapist. They can help you with this part and it will speed up your training process, maybe already by like 50% or maybe even 100% at a time. So the first step is to look at the management, and I hope this is a bit clear. I could continue also a long more time about pain, but we're just gonna keep it with this. If you have any doubts, please check out if your dog has pain. So then we're going to go to the second step of the care procedure, is the foundation. And the foundation is very, very important because without it, we would fall over. So the first step is the chain of associations. And that is sort of a overview also for yourself and also for myself to make it clear by owners, but also for my dog, when is there a choice situation and when is there no choice situation, because that's a very important thing. So first, a choice situation is a context ritual that you create for your dog. You're gonna show what you're gonna do. Maybe we're gonna do nail clipping today. Maybe we're gonna do brushing today. Maybe we're gonna brush the teeth today. And then the dog says yes, and then he gets the procedure. That is the choice situation. Then we also have the no choice situation, and that is usually going towards the dog. Also saying, okay, here I have the nail clipper. The dog accepts it and the dog gets the procedure. And to make a difference between those two change is very important, because if we're gonna learn the dog in the choice situation that he actually has a choice, and eventually we notice like, okay, maybe we're in week 4 of like training your dog to be accepting of the nail clipping, and then suddenly he tears down his nail a little bit, and you actually want, or you actually need probably then to cut it a little bit. And you're like, okay, I'm not that far in my choice situation, but if we're gonna do that in the choice situation and like your dog's already like, okay, and a little bit relaxed, and we're gonna do that, it's gonna break the trust. Because if we then cross his boundary, he's gonna say, no, this is not what was gonna happen. It was a choice situation. So please make sure that you make a difference between it. And how we're gonna do that, we're gonna focus in the next slides. So it makes it clear to have those two situations, because usually we can use for the no choice situation the old situation. So what I mean by that is, if your dog has trouble with nail clipping, for example, you usually now go towards him, or you do invite him over, but generally it's in the living room or in the hallway, and you're just gonna clip his nails. Keep it that way. I'm also going to give you some tips for it, but keep it that way, because then your dog keeps knowing, okay, now I don't have a choice. It's going to be not nice, but it is how it is. And sometimes it's really unpleasant that it has to happen, but that's the downside of care. Remember the first pillar that I said, like physical health is very important. Because if your dog doesn't have the right physical health, it will also get mentally impacted, which also then again makes sure that also physically will be impacted again. So it's like a circle that you don't want to get in. So please make sure that you first have the physical health in order before you're actually gonna go train, or before you're gonna do the old situation. Sorry, not the old situation. Before you're gonna do training with it, with the new situation. So in the old situation, what you're gonna do is you're gonna make the clear difference between it. So you're not gonna use any start buttons. You're not gonna use any things that we use in the choice situation, which I'm gonna go back on a little bit later. So in the no choice situation, you're gonna do it in stages. So you're gonna build it up step by step, but, and now comes also the interesting part, you're gonna choose if you're gonna do high stress or low stress. So for example, if you have a dog that hates bathing, for example, you can put your dog into the bath, and you're gonna do maybe very quick and like, okay, high intensity, and we're just gonna pull all the water over you, and we're just gonna clean you very quickly, so you don't have to do that for too long. Or we're gonna say, okay, we're gonna put you in the bath. We're gonna do it in like very slowly steps, and then very slowly we're gonna bathe you a little bit. We're gonna make you a little bit wet, and every time you get also like maybe a treat. And then it takes longer, but the stress is lower. For some dogs, depending on which procedure it is, high stress, short time is more preferable. And for some dogs, low stress and longer duration is more preferable. And it can also change with any procedure that your dog might needs to undergo. And of course, use treats, because I sometimes still hear it from groomers that they don't want to use treats, but you can use treats, because treats can make it so much more nicer for your dog. Another part of a no choice situation can be distraction. I'm very a pro of, or not a pro, how do you call it? I'm very fond of a distraction. However, it does has a side note. It has a risk that the distraction becomes a predictor of the certain procedure that you're gonna do, and that your dog, if you use, for example, for a licky mat, that your dog doesn't want to lick the licky mat anymore, even though it can be great for other purposes. So what I always say is when your dog is sniffing in a sniffle mat or your dog is licking the licky mat, always make sure that when they are licking or sniffing, you are touching him. So that's a little bit of the rule. If they stop, then you also stop with the procedure. And in that way, they still have a little bit of control over it, but they are still getting the procedure with a little bit of, I'm distracted by it. So you can definitely use it, but just make sure that it's a positive experience for your dog as much as possible by giving him sort of the control over it. Also, it said if your dog has resource guarding, you might not want to do this. So then it's just like a very stressful maybe situation, but don't use it with it if your dog has resource guarding. So a nice example actually from actually 2 days ago, my dog got operated last week for a fat lump, and she has quite a big scar now on her stomach, which needs care. This video, I'll see if I can turn the light a little bit. You can see that she's standing on her block, and then I'm showing her, hey, I'm gonna touch you with the little cotton pads, and then you see, okay, she's gonna undergo the procedure. So I'm cleaning here her stomach a bit. You can see that she is stressed, that she's looking away, panting. Then I'm trying to sniff it because I wanted to smell if it was like infected. And then she was like, no, no, this is too much. But she recovers, comes back on it, and I continue the cleaning a bit more. But while I put the little pad under her stomach, I'm also trying to like reward her for staying there. And this is what it can look also like if you have to do a procedure. And thankfully, we've trained for this a lot of times, not specifically for the pet, but we've trained a lot on this certain behavior, but that's where you want to go. So what I want to say is like the no choice situation is a temporary solution. It might be a forever solution if it's like something that your dog only has to undergo maybe like once a year and you don't have it prioritized. But otherwise, you always, of course, want to work towards a choice situation where she can opt out. For example, here, if she would have opted out and if she wouldn't have come back, I would have probably given her like a little brain game or something to do, or like we would go out for a walk and then we would come back. I would not give her a choice and she would undergo the procedure to make a difference that she doesn't have a choice back then or right then. But you can do it in that way. So we're gonna focus on the choice situation because that's of course the part that you're gonna work for. So we're gonna focus on the context ritual, the showing the material that we're going to use. The dog says yes, and then we're going to do the behavior, or sorry, not the behavior, the procedure. So the first step is creating the right context. So creating the right context, 9 out of 10 times I use a yoga mat for that. A yoga mat has as advantage that it has non-slip. It's also a very good indicator and predictor of what is going to happen. Because if you put that down, it means, okay, the choice situation has started. If you don't put it down, it mean it doesn't has started. So you always make sure that you use the yoga mat, or you're gonna go to a specific room, or you're gonna go to a little, how do you call it, a carpet, where you're gonna go when you say, okay, this is always our place when it's a choice situation and not a no choice situation. An advantage of the yoga mat is also that you can, if you buy a cheap one, you can cut it and you can also bring it to the vet or to the groomer or put it on the groomer's table. So I am very big fan of yoga mats, but that's the first step that I want to give you for tonight. The second step is introducing the object. So I always look at the sensory that the dog might experience. So the sight, the sound, and the smell. And I'm a little bit curious because I know we have some people. If you, and I read already like the nail clippers, if you are showing your dog the nail clippers, or if you're going to show your dog the eardrops or anything in that way, is your dog scared? Like, does he run away? Usually that is the case. You can say it in the chat if you want to. Yes, but that's usually the case. So I have a dog in guidance who runs away when he hears the drawer open downstairs. And that's the first thing that we're also gonna tackle. So what we're gonna do, I always say, you get a beautiful beauty case. And in that beauty case, you're gonna put your comb, your eardrops, your, all that kind of stuff. And you're gonna put that beauty case next to your yoga mat. And if your dog is really scared of the material that you're using or like the objects that you're using, then you're gonna make sure that the beauty case first like closed really, and then secondly, no. Okay, no, sorry, I see a sketch on my screen, but it's not. Yeah, okay, great, thank you. So, and secondly, if your dog is very scared of it, then we're just gonna close it and we're gonna open it very slightly. Or maybe you have like a soft bag that you're just gonna open step by step. If your dog is quite okay for it, just still get the beauty case because it is a very good indicator that is again a choice situation. And that's how you also like make the difference to it. That's the first step. And then if your dog is okay with the beauty case there, you're gonna put some treats around it. You're gonna maybe like put your hand in the beauty case and then put some treats around it. You're gonna maybe like lift it a tiny little bit up and then put some treats around it so that your dog is gonna be okay with seeing the objects. And that's just the first step. We're not gonna put them towards them because that is in a later phase. We first just want to have them very normal and very here. So that they're just like, okay, fine, those objects are there, it's fine. So put them in a beauty case, put them next to the yoga mat, throw some treats around, and then just slightly drop them. And if you have a nail clipper, knip like a spaghetti string so they can also hear the sounds. If you have like an eardrop, open the little bottle and also throw some treats around it so you can make the connection for them. I see. Okay, so again, we have now discussed the context ritual, the yoga mat, how to introduce the object in the beauty case, and now we're going to focus on the dog says yes and the procedure. So this is a dog in guidance who was for the brushing the teeth. So you can see she's here brushing her teeth with her finger. They are now onto the cloth, but here was still over the finger, and it was a beautiful video because here she wants to continue. She's asking like, hey, can I continue? He slightly puts his head away and then she can continue again. So you can see very clearly, he says yes, she comes and he's like, not sure yet, but okay. She waits for a second and then he comes back. And the beautiful thing is this is called a start and continue and even a stop button that you have now seen in this video. So we're gonna talk it through. Body language is the first important step on how to use start, stop, and continue buttons. I hope you're all aware of the body language. And what I want to add to it is that if you see those if you see these small signals, if you see 3 of them in sort of like 1 minute, then you know you are getting too far. And it can still be okay, but it is a mental note for yourself. I usually say, okay, hey, this dog is not very comfortable. Maybe I just need to take a small step back. Now, how does it look like? Also, this was the video that I just showed. You can see here that she is like panting. She's panting. She's like eyes a little bit closing. She also has like those sacs behind her eyes. I don't know how you call it in English. I forgot it. And you have the ears going back. You can see she is stressed, and then afterwards she steps off her start button because she's like, hey, I show you that I'm not comfortable. Because even when we are using start, stop, and continue buttons, we always still have to make sure that we observe the body language. For example, right now I'm sitting on under her stomach, so I can't really see. So that's why it's great to have a start and stop button. I missed those signals because I couldn't see it, but it's so important if you can, and especially like while building it up, you always have vision or mostly have vision of the stress signals. Because what makes a start button a start button? A start button is a behavior in which the dog experiences choice and control to show this behavior in a certain context and is followed by a predictable consequence, such as a care procedure followed by a reinforcer. It's a whole big sentence. But a start button is simply said like a sort of press of your dog who says, okay, yes, I'm ready for it. Let's continue and let's do this care procedure or any other consequence. First, we're going to focus on the choice and control. So control is the idea of being able to influence the outcome of the situation. And I noticed that also when I have dogs in guidance that they are mostly not scared of the procedure itself, but it's the ability to lose control. A good example of this is a monkey research. They also researched that when the monkeys got control over the noise that they were hearing, they had very low cortisol levels, and they were the same as when they didn't have any noise. Without control, the cortisol level was tremendously higher, and especially when they lost the ability over control. And control is a thing that everyone actually wants. It's a way to fulfill your needs. And you can almost see it as like a primary reinforcer. You want to work for it, they want to work for it. So for example, here you see a dog on the grooming table licking his licking mat. And again, like I just said to you also in the no choice situation, if he licks, the grooming can happen. If he stops licking, we also stop. So he has the control over it. But is the fair choice? That is questionable. So then we're going to move on to the second to choice, because that licking mat is not really having a fair choice, because choice is having the idea to choose between something. And if he stops licking, he doesn't get the food. So it's like an unfair choice. However, they do have the control in that situation. So that's why it's not a preferable way, but it can still work. But choice is very important, and we are going to implement it with the choice situation, of course, because the more they have, not always, but mostly the more they have, the more they like it. So for example, here you can see a dog laying down, and this is based on one of the true events that I had with a client a few years ago. It was a Shiba Inu. If you know Shiba Inus, you know that they are very strong opinions. They want to have their own opinion about it, which I love. So what you can see here is you see the dog laying on a few pillows. You can see a table left bottom here, and also like a little table on the back. And he could decide, he could choose which care procedure he wanted to do, or like which behavior he wanted to do. So if he wanted to lay down, so sometimes what they did a few sessions laying down, then they went to the other table to like put his chin on something, and then they went to the other table to stand on something. So in collaboration, they could decide, okay, which one are we gonna do now? Is it a way if you need to do it right now? No, but if you just need to nail clip, or if you have to administer like eye drops once a week, or if you have to groom it, it's not like an emergency, then yes, you can still do it and also keep your dog motivated in this way. So that's a bit the difference between control and choice. And I hope it's clear, but if it's not, also please let me know, because it's a very interesting topic also to talk about. So with start buttons, we actually use control and we use choice to give that back to the dog. So what behaviors can function as a start button? I have 3 foundational exercises for you, and that is the chin rest, the laying on the sides, and stand on an elevation. And I truly believe if your dog can do all these 3 things, you can, like 99% of all care procedures you can do with your dog. The chin rest, you can do like head stuff. The laying on the side, you can of course like also even do the paws very easily. And standing on an elevation, you can also do it like with their tail, or like with their back paws. You can easily do all that stuff. So we're gonna continue with the first exercise, and that is the chin rest. your dog puts his chin on something. So in this case, these are my knees, but it can also be your hand. It can also be a little stool that you use. It can be anything. I would very recommend to use your knees or to use a stool, and that's very easily for a very simple reason. Then you have both hands available to do the care procedure. So the chin rest is very nice for if you want to brush your dog, if you want to even put on a harness on your dog, because then you can ask the chin rest on your hand and you can have the harness right here and you can like lift it over your dog's head. Um, but also even for nail trimming, it can be used like your dog puts his chin on a stool and you can sit next to them and you can just like lift their paw up. But mainly, and that's the main reason that I use for it, it's eyes and like the teeth and like the ears, because you're stable, his or your dog's head is stable and you can easily reach all areas. And it's a perfect exercise for it. Just make sure, and then we're gonna go to the next one. If you're gonna teach it on a few things. So if you want to teach it, I always recommend to like shape it, because that's the easiest way if your dog is used to shaping. Otherwise, use a target. So place a stool, put the target behind it, like your hand target, or like maybe I usually use a spoon for it, a spoon target, or just guide him with a treat on the stool. But if you want to make it a start button, and we're going to talk about it a little bit later, then you need to make a little bit of change into that. But teach them first the behavior in a certain way. Again, if you use shaping, you're already there, and that's great, because then they're going to learn, okay, hey, if I just see that cloth on the stool, or if I just like in this context on the yoga mat and I see that stool, I need to put in my chin and I get a treat. So then the second step is reward for in being in position. So reward for the first 1 to 3 seconds of just keeping his head on the certain object that he's laying it on. So very important with the chin rest is that you don't ask it too much. I see it so many times happen that people are like asking it and asking it, asking it, and the dog is like, oh, I have to put my chin again on it. Some dogs are very eager, but I have to say most dogs are like, oh no, okay, here we go again. So ask it maybe like 2 or 3 times. That's it. Then you're gonna stop that and you're gonna change to a different exercise, and maybe you come back to the chin rest after, I don't know, after have you done a few cute tricks with your dog, then you're gonna say, okay, we're gonna do it one more time. Um, Also, I already said it already a bit, place a cloth on your hand or on your stool. In that way, your dog really knows, okay, hey, this is a different situation that I'm used to, which you then can use as a choice situation, of course. And the very nice thing about this is if you teach it at home on the stool or in your hand with the cloth, you can bring that cloth to everywhere. You can bring it to the vet, you can bring it to the groomer, and in that way, you don't have to like bring your whole chair with you. You can just bring on your cloth. Also, if you want to make it like more an inclusive behavior for all kind of care procedures, make sure that you train your dog to stand and not sit while giving the chin rest. But if you're just using it for your dog's head, of course, it doesn't really matter if they are gonna sit or if they're gonna stand. The second exercise that I want to also show you is laying on the sides. As you can see, if your dog is laying on the side, it's very easy to reach all paws, to reach their stomach, and to also even reach like between, like by the chest. So it's a very nice behavior to reach. Oh.
Yay.
Yes, okay, great. It's a very nice behavior for every care procedure. Also for nail clipping, but, and now comes the part that makes it a little bit more difficult. It's less useful for the veterinarian or for doing the exercise at the groomer. It can be done inside and at home. I've had dogs who just fell asleep while they were laying on their side and getting groomed eventually, but it's not really appropriate for the vet, and that comes because usually your dog's stress level is already quite high. And laying on the side can be very vulnerable. And sometimes it can take weeks before your dog is really okay with you, sitting next to you, and being okay on laying on his side. However, if we're going to teach it, ask for a down, guide your dog on one hip, one side of a hip, guide them on the shoulder. And I always say, because some people say like, yeah, my dog really doesn't want to lay on his side. I'm like, okay, that's really possible. What you want to do is if you have your dog in front of you and you guide them on their shoulder, so he's laying on his stomach, he already changed one side of his hip towards one side, and you're gonna make this step towards his shoulder, laying that flat. This part of like laying their shoulder on the ground is usually the scary part for them. They have to fall. They have to also like put their shoulder a little bit in and they have to fall. If your dog finds that scary, put a pillow right beside him so that he can fall into that. And first you're gonna put the pillow very straight so that he's just like laying against it, and it slowly but slowly you're gonna lower the pillows that he just has to fall more and more and more. And in that way, I think I've only now had like maybe 1 or 2 dogs that didn't still want to do it, but they had like hip problems or like back problems or something. And otherwise all dogs eventually, and sometimes it took, like I said, also quite some weeks, but then if you have this behavior from your dog, it's an amazing behavior and you can do so much with it. So other 2 tips, reward with your dog on your dog's side of his mouth. So if you place him in position, keep rewarding with your hand on this side, because the other hand you're gonna use to eventually start touching him in a while. So we just want to make sure that we just keep one hand by his mouth so that he knows, okay, this hand is predicting food, this hand is not predicting food. Eventually, if your dog is trained to it, you can switch hands, but in the early stages, I would recommend using one hand. And like I said, like use the pillow and also make sure that if you're guiding your dog on the side, on the pillow, or just in general, use multiple treats when you're not putting him down, but when you're like guiding him a little bit more down. Just take 5 hands, just take 5 treats in your hand and just like slightly drop them while you guide them down. That's what I want to say. Okay, the third exercise is standing on an elevation. And here you can see that she's standing on quite a high elevation. But also this exercise is perfect for brushing, for even putting on a harness, for blow drying. Almost every care procedure can be done while standing on the elevation. You sometimes have a challenge of dogs who are like very like wiggly, but I'm gonna give you some tips for that. Because standing on elevation, you can also again shape that. You can use the target in front of the just above the elevation, or you can guide them on the little elevation. Also, reward this behavior the first 1 to 3 seconds when they are standing in position. Make sure that you really do that, because I see it so many times the dog is standing on it and we're like, oh great, this is good. Okay, well, let's throw away a treat. And then the dog comes back and then he's like, oh, I need to step off. No, if he stands on it, reward him for that position, because that's eventually what we want. So if he stands on it, just reward for the 1 to 3 seconds in position. Like I said, it can sometimes be hard for some dogs because they're very wiggly. And then it's very important to, one, also decide if this is the right exercise for your dog, but two, also just make very tiny steps into it. But also, maybe you already continue, if your dog is not too scared by being touched, already start touching or start counting so that your dog gets information that he's doing something right. Those are usually the 2 tricks that I advise when it's hard for the dog to stay on it. Make also sure you don't have a elevation that is too high for your dog, because sometimes, especially also in this picture, you can see that she really has to step on. The plus side is that she is harder to step off. The downside is that it's harder to step off. So also for some dogs, it can be harder to really say yes, or also even to opt out. And especially if your dog has more stress or like more anxiety with it, it can be like a sort of like ambivalent behavior you're getting then. Like, I want to stay on because I want to have the treat, but I also don't want to stay on. So it's going to be harder for them. And then you're going to see the stress signal. So that's why usually I now actually recommend just a wooden cutting board. And it's so perfect because it's like 2-3 centimeters. Most dogs like it. It's anti-slip or it's non-slip, and it's just perfect for them. So make sure it's also like a sturdy, hard elevation to stand on. And if your dog has behavior problems, not behavior problems, but has back problems, just make sure that you talk about it with your vet before doing this on a higher elevation. Sometimes I also even recommend to just like put a little magazine or like tiny little paper almost to just have your dog a sort of target, but that's it, not to elevate on it. Then, what are continuous buttons? And actually, they're quite simple. They're just the start buttons, but then the dogs keep doing them. So they keep standing on the elevation, they keep standing, or they keep laying down, or they keep putting their chin on the target. A few pitfalls that I just want to quickly address. Make sure that your start button behavior is first fluent before you're gonna add in a care procedure. So you want to put down the elevation, for example, and you want your dog to stand on it without any cues, just the elevation is the cue to stand on. That's his start button. If you see a delay in that, first train that out, because if your dog is having a delay with it and you're gonna add the care procedure, you're not gonna be sure if it's the care procedure or if it's just not trained well enough. So also unaided, don't help your dog with it. You want, or like when you are training for your dog, of course you can help him with it, but eventually you want your dog to be able to see, okay, hey, this is the context. If I'm doing this behavior, then I'm gonna stand on it. Also make sure that your own position is like right in front of your dog, and usually I start in front because that's what they're used to, and gradually building up it from the side, because usually the scary things happen from the side. So make sure that you take that into account, and that you start at the front and then you end at the sides. Also, duration. Don't expect your dog to like stand on it for 10 seconds the first time. Build it up second by second. Then you also have the stop buttons. Stop buttons are the agreed stop buttons. Those are the first ones. So like standing off the elevation, lifting his head up, or lifting his head up when they're laying on the sides. But also a delay in start button. So I was just saying it. If you see a delay in the start button, it can indicate that you went too far, and it is actually a stop button that your dog is giving. And of course, the stress signals. And I want to show you the video of this dog who was in guidance, or just turn down the music a little, sound a little bit. So what you can see is she's turning on the blow dryer, and he is giving his approval for it. So he stands on the elevation, and then she turns it on, blows to him. You can see like he's like, ooh, like going away, lip licking. He gets a treat for it, already showing the signals like it was a bit too much. So again, she put it on, and you can see it again. He is like turning his head, standing there, and then he's like, nope, I'm out, too much for this. And that's the beautiful thing. This is like a stop button. So he already gave actually the stop, but we thought, oh no, we can do it. And then it went too far, and then he stopped. So that's the beautiful thing about stop buttons. Do we need to reward stop buttons? Yes, because stepping away is already reinforcing the stepping away behavior, because the thing is, when they do that, the procedure stops. So for example, if they stand on the elevation, we are touching them, and then they are stepping off, we stop touching. So they already learn, okay, hey, if I find it too aversive, I can just walk away. So it doesn't hurt to give them still a treat, to make also the choice, not the control, but the choice, a fair choice. And also, and that's the most important reason, because a lot of people are going to have this question also if you discuss it with them probably, is that you want to prevent that from happening. If they're gonna say no, you went too far. So that means that you have to take a step back, get into the reinforcement of the behavior that you want, and then maybe it will happen. Sometimes it will happen, but it won't be rewarded as much as the behavior that you actually do want to see. I'm gonna take a little sip. And looking at the time, I have to make a little bit more speed. So how does the chain look? We now talked about the context ritual. The dog gives the start button behavior, the chin rest, the laying on the sides, or the chin rest, I have to say. And then we're gonna put in the procedure, and then the dogs get a treat. So first, as you can see, you build it up by having the context, by building up the startup behavior. There is no start button itself working yet. It's purely just teaching him like to sit or giving him a paw. And now we're gonna add in the procedure. So building up the procedure is gonna be two things. One, counter conditioning. So your dog gets maybe 1/10 of the procedure, and that gets followed by a reinforcer, like a cookie or like a play, something your dog likes. So he's like, okay, hey, I'm standing on the elevation, I'm getting touched at my shoulder. Oh, this is quite fun actually, because every time you touch me, I get a treat. Okay, this is quite fun. Secondly is desensitization. And desensitization is the exposing systematically in very small steps. So again, if we're going to start with this example, if I'm going to pet the shoulder of the dog and he's going to get a reward, it's a very small, tiny step. If I'm gonna put my hand on the shoulder and I'm gonna grab it the first time, he's probably gonna think, oh, what was this? So what we're gonna do is we're gonna build it up in like very, very tiny steps. A very good example of this is when your dog is reactive and he sees a dog in the distance. You look for a certain distance that your dog is not reacting yet. And there you're gonna see like, hey, does he acknowledge the dog? Okay, yes, he does. Okay, here you get the treat. Okay, maybe we can take one more step towards that dog. Okay, hey, he's still below threshold. Okay, great, we're gonna give you a treat. And that distance is what you also want to have with care procedures. With care procedures, it is unfortunately not as literal as with the dog on distance, but I'm gonna give you three things that you can look at. The first thing is the regions in your on your dog's body. So I have here a picture of a normal dog who, or like most dogs have those areas, like green areas, yellow areas, orange and red areas. And by most dogs, this is sort of the places where they are. You always start in the green area. For example, if your dog is not fond of being touched by his paws and he stands on the elevation or he lays on his side and you want to start with that, you don't grab his paw. The first thing, you first make sure that he does the behavior. You have this first 1 to 3 seconds of like a continuous behavior, and then you're gonna first touch him very shortly on his shoulder. He's a green area. Maybe he still gets a little bit startled, but that's where you start. If that's gonna go okay, then you continue down to the area that you want to. So make sure also for yourself that you just have like a mental picture in your head. Okay, which area am I first gonna practice in? And also make sure that if you're working on an orange area, it's gonna take you a little bit more longer the time. Maybe you like really need to like shove your hand like very centimeter by centimeter to get there and make a lot of counter conditioning happening there. Secondly is duration. Again, if we're gonna put the dog on the side and we're gonna like brush him for 10 seconds, even though we're doing it on the shoulder, it's gonna be probably a no from the dog because the dog is probably like, hey, we didn't practice for 10 seconds and now you're brushing me for 10 seconds. Like, what is this? This is weird. So we're gonna build it up second by second. And I always say like start first with like just 2 seconds. Though put your dog on the, or like your dog stands on the elevation, brush him on the shoulder for maybe 2 seconds. That's it. And then you're going to build it up second by second. And eventually, if they really get the hang of it, like 5 seconds, you can maybe build it up by 5 seconds. And then if they get the hang of it like 20 seconds, you can also build it up for like 20 or 30 seconds, even more by every click. So secondly is duration. Thirdly is the intensity. So again, you don't start with like grabbing the paw, that's the zone, but even if you have put your, even if you're that far, like you have put your hand on the shoulder and you've put your hand on the paw and it's continue and continue and continue, don't grab the paw and like cut it with a nail clipper because then again you're probably gonna have a no from your dog and he's probably not gonna come back in that choice situation with you. So first thing that we do is maybe we grab the paw, we're just gonna touch it lightly with our fingers. If that's gonna go okay for him, after rewarding, we're maybe gonna squeeze it a little bit with our fingers. So the intensity is gonna be broken down into like smaller parts. So if you have a nail clipper, for example, it's gonna put pressure on. It's maybe cold metal that is going against the nail. It's hard. It makes a sound, of course. But most important is we're gonna break it down. So we're gonna squeeze it. We're gonna maybe like tick on it with our nails. We're gonna maybe pull a little bit on the hairs so that your dog gets prepared for the nail clipper. And also shown in this picture, you can see a soft brush. You can see a, like, we call it a slicker brush. It's like a brush with like a lot of pins on it. And you also have a glove brush. So the soft brush can even be more intense for some dogs than the glove brush. But you can also like build it up step by step so that your dog gets used to it. And again, then we're going back to like the desensitization and like counter conditioning. Your dog needs that gradual exposure, otherwise they're gonna say no. So we're gonna see some last videos about it, how that actually looks like. Because, for example, this is the dog who also has learned how to brush teeth. So the first step for this dog was, for example, to teach the chin rest. So he's put his chin on the pillow. He needed duration for this. Then first, like finger brushing, so just like brushing with the finger. I also for the tooth tool, for this little small thing, he needed to hold it, also with duration, and then they needed to combine it. So then again, it was probably first finger, so grabbing it first finger and then the toothbrush. So also they have built it up in small steps. This is also one of the dogs in guidance, a great, very sweet, lovely dog. And she was scared of her harness. What you can see here is a little fleece rope. And it's a preparation for getting on the harness. So the first step that we did with this dog is being okay with the side of the harness, the sound of the clips of the harness. And then what you can also see here is being touched with the fleece rope. In between, we also still have to focus on standing on the elevation for time, touching her with the hands, touching her on the chest, on the back, on the stomach, everywhere where the harness will be. We have touched her first with our hands. That went okay. Then we moved on to the second step, and that was using a little cloth because she was so scared of all those little of all those things. We first used a small cloth, and we were just gonna like touch her with the cloth everywhere. That went well, and then we continued with the fleece rope, as you can see here, touching her first maybe on the shoulder. And then eventually we went also to this step, like opening it, putting it on her neck, and it was very scary for her. And then even like pressing a little bit on it. The next step is the harness, and they have actually now do that step already. They have put now the harness on her back already, and like they have already like closed it a little bit. So that's how you also build it up step by step. Here's the beautiful other dog again. He was also in guidance for the blow dryer. Again, he stands by on the elevation by himself. Also duration for it. You can see that she's touching him first with the hands, leaning over, but also the movement of the dryer hose. That is just like when it's off, also already around him. And then also the sound of the blow dryer. So they actually also practice it not only with this start button, but also with a different start button to just get used of the sound. Maybe you have to record it and then play it for your dog and combine it with treats. And then also the air. And the air is quite a difficult part because you want to like first put them a little bit under their paws maybe so that they can like feel a little bit the edge to it. And then they all combined it. And then eventually they came to this part. Standing on the elevation, even with a brush, and then blow drying the dog. And that's how they build it up step by step again, using the start buttons. And also made sure that the dog was okay emotionally. And that is the most important part, of course. So, an overview again, where we started an hour ago and where we're now going to finish, is management. Are there other solutions? Does pain play a role? what is the foundation of your dog? Do you have like the well treats? Do you have the yoga mat? Do you have the choice and no choice situation clear? Then also start and stop buttons. So we have looked at like which start buttons you can use. Look at maybe the chin rest. Look at the laying on the side. Look at the standing on the elevation. And there are a lot of also videos online to show, okay, how can you teach that? And then if you want to like transfer it to a start button, make sure that it's fluent. And then we can say, okay, hey, it's now fluent. You can give your behavior. Okay, we're gonna add in the little tiny parts of the procedure by first touching him on the shoulder, and then maybe and then like expanding it step by step towards the procedure of like, for example, nail clipping. And then after that, if it's gonna go okay at home, then we're gonna expand the procedure to different locations, to different people. And basically you're gonna start back from zero and you're just gonna build it up, but it's gonna go way quicker. So that was it. I finished in the hour. If you also want to follow me, zorgsnurdwang, Tamir op den kelder might be a little bit easier if you're English speaking. You can always follow me or send me a direct message if you also have any questions. And I would love to see if you have any questions right now. But that was it.
Awesome. That was a wonderful presentation. Thank you so
Thank
much.
you.
Absolutely pop some questions in the chat box if you guys have any questions. I already see that there's been one so far. So yeah, please let us know if you guys have any questions. The first question that we have is, when you say duration, does it mean 1 to 3 seconds?
Yes, 1 to 3 seconds. Yes, we usually think already, okay, hey, we're gonna take 5 seconds and we're just gonna be that's already small. But usually most dogs are already very hesitant with the first second. So that's why I really recommend build it up step by step, especially the 1 to 3 per seconds. Yes.
How would you approach a dog that's prone to guard things, especially like a start button?
Mm, interesting question. Good question also. Um, I would, it depends really on, it really depends also like how intense it is because, and also where the behavior is coming from. That's my first thought. Secondly, it's hard to be fair. If your dog is guarding, for example, an elevation or is guarding a cloth, it can be hard. You can, of course, use your hand because I hope he's not guarding your hand if you give him your hand. But it's a very good question. I would first work maybe on research guarding, like first make him feel comfortable that you are being around a subject or an object that he is also nearby. But I think that is a question. It's actually a really good question. That you first have to work on the resource guarding before you can do the training. Because usually, what I do notice is when dogs are having resource guarding, they are usually also very wary of their own body. So I would first just recommend, okay, just maybe sitting next to him and just like rewarding him for that without any object. But it can already happen without an object. So I think it's best too safe to say, go to a behavior consultant and first talk it with them about that. Yeah, it's a hard question, and it's not easy to solve with just a few tips.
Awesome. Thank you for that. The next question that we have is, my dogs are great at having their ears and teeth cleaned, and we have a routine of opening the clinic where they know what to expect and how to do it. They both, however, hate having their nails trimmed. Would you suggest working on this, incorporating it into our current routine, or working on something new for the nails specifically?
Great question. Great question. If that's a situation where they can say no, I would say work in that situation. Just continue working in there because it's already a safe environment. If they not always can say no in that situation, then I would recommend you starting a new situation. But specifically for the nails, you can work in the same situation. So what I usually recommend is putting the yoga mat as a sort of foundation. On the yoga mat, we can do different procedures. So maybe one time it can be teeth, one time it can be nail clipping, but the yoga mat is the foundation for that. So if you already have like, I love it, opening the clinic experience, and they're like, they know it's okay, this is what we're gonna do and it's safe, I would just definitely add in the nail clipping to that.
Awesome. That's a great tip. For brushing teeth, how do you work up gradually if you need to brush every day?
Ah, great question. Also, make a difference between the choice and the no choice situation. So right now I have a few dogs in guidance who are having that, and they have also like molars being extracted. So they need to brush their teeth like really, really every day. So one time a day is like a no choice situation, and the other time is a choice situation. So you go on the pace in the choice situation in what your dog is saying. So if that take maybe 2 months, it can take 2 months before you're able to brush their teeth in what you need to do. And that's why you have that no choice situation if it's really needed. And that's why I also said at the beginning, sometimes it's not that nice because we have to care for them and we have to make the physical health still important. And that's why you have those two situations. So yes, it can, and you just have to build it up very in tiny steps in the choice situation. I hope that's clear.
Yeah. One last question we'll take is, what do you recommend if my dog always says no to nails trims when doing the choice situation?
Yes. Oh, love it. Again, make stops much more smaller, like very, very small. Like if he says no to nail trims, you're probably somewhere going a little bit too far for him. So I also have, I think, one dog now who has been training with me for like 4 or 5 months, and he is now at the point where they can touch the nail and squeeze the nail with the nail clipper besides them. But it has taken 4 to 5 months, almost everyday training, and that is also because the dog has like traumatic experiences. But it can take so much more time, and that's why you need to know your why, because you need to keep continuing in those little tiny small steps. So if he says no right now, just make sure that you make the choice situation very fun, and just start at those like one of the three behaviors, maybe like laying him on the sides, asking that, and then just first touching his shoulder and first touching his paw with your hand, and just start from there. And then yeah, you can gradually build it up to hopefully then getting a yes in the try situation. And of course, one last thing about that, also make sure that you exclude pain, because if he keeps saying no, it can be also a pain thing, especially in the paws and especially in the nails. It can be, yeah, it can be a thing. Yeah.
Those were some awesome answers. And again, if anybody is local to the Austin area and needs support on these cooperative care things, make sure to schedule a lesson with us. We definitely love cooperative care here and know how important it is to all of our pet parents and our pets out there. Thank you so much for a wonderful presentation. We appreciate it so much and we look forward to working with you soon.
Thank you.
If you guys have any more questions, you can always feel free to either email myself or email our info@everydogaustin.org. We will make sure to get those questions answered for you guys. Thank you guys for being here today. Thank you guys for who donated. If you guys are interested in donating, you can see everydogaustin.org/donate. And we appreciate you all. Have a wonderful afternoon, everybody.
Thank you
Thank
so
you.
much.